Stomach and digestive issues are a lot more common than you might realize.
Yeah, and there's now a new center at Middlesex Hospital where you can go to get some real help. Joining us now is Dr. Nadeem Hussain, Director of Gastroenterology at Middlesex Hospital. Thanks for being with us, Doctor.
Thank you so much, Scott and Kara, for having me.
Oh, it's our pleasure. So first of all, what conditions do you treat there at the center?
So I'm a gastroenterologist, hepatologist, and I have been practicing at Middlesex for more than 15 years now. And so far, over the past 15 years, we've really built our program. And now we even do a lot of specialized testing, including endoscopic ultrasound, where we can look at structures outside of the GI tract. And we're doing video capsule endoscopy to look at the middle part of the intestine, which can't be reached with endoscopes. And we're doing motility testing and reflux testing. So we're kind of covering all the basics now of digestive disease. But the special thing about this program that just started in the beginning of October, so just a few weeks ago, is that we're now including specialties beyond the digestive program. So that includes things like psychiatry, nutrition, physical therapy. So this way we make sure that we treat the patient as a whole as opposed to just their digestive program.
Especially because we know that from so much research that the gut and the brain really communicate. This is what's so troubling about things like IBS or Crohn's and colitis, all these different conditions that people are suffering from. It can be complicated. How do you get people to get to the bottom of it so they can heal?
So that's exactly the problem we run into. So if someone might be experiencing abdominal cramping and diarrhea, but at the same time have this anxiety overlay, which is aggravating all their symptoms. And just because they're dealing with that all their life, they don't even realize that that's part of the problem that could be aggravating their symptoms. So if we can identify those patients and then get them treated appropriately with the therapist, possibly even with the dietitian, then we might be able to treat those problems, which might help alleviate the GI type of symptoms too.
Well, Doc, last night I had a stomach ache. I think it was because I was eating this salsa and it was wreaking havoc on my digestive tract. What's the difference, and how do you know that you should seek medical conditions or go to this center? If, how much is enough is too much? When do you recommend we show up?
Oh, sure. So a lot of people experience heartburn, especially with the types of foods that one might eat. So if it happens occasionally, it may be okay. But generally, over the age of 40, if someone is experiencing heartburn or reflux, or if they're noticing that liquid and solid food is climbing up the esophagus, or if they're waking up at nighttime with the symptoms, all those are good reasons to seek further attention. Even if there's a smoking history, that adds to the risk. So, and the main thing we want to make sure is that there's no precancerous changes developing. And if there's something that we could do to intervene to keep things from getting worse, then we can do that.
I have people in my life who suffer from these bowel issues, and it's so frustrating. So one of the things that you're trying to do with this center is you have everybody on the same page. Mm-hmm. So your regular doctor and your nutritionist, everyone's talking, so everyone can really help this person do what they need to do to get better.
Exactly. So for example, with the reflux issue, if we identify that we need to control the can you hear me okay?
Yes, absolutely.
Yeah, sorry.
Okay, great.
But yeah, what you were saying is that I know that your program even comes with a nurse navigator, and you're going to...
Which I think is amazing. Just someone to get you through the whole process.
It can be overwhelming and confusing when you're trying to figure out which is causing what.
Oh, sure. Yes, exactly. So in the reflux example, for example, we can measure how much acid is objectively climbing up the esophagus over the next 4-day period by attaching a little capsule to the lower part of the esophagus. There's ways we can pass a manometry probe through the esophagus and measure exactly what's happening with the muscles there. And if there's a need for a surgery, we have a surgeon who specializes in that issue. And there's advanced procedures that can be done to tighten up the lower esophagus and keep things under control that way. So there's so many different things that we could do to try to help with that.
Doctor, thank you so much. And we want everyone to know that this is available right now at your new center. So maybe they can finally get the help they need. For more information, go to middlesexhealth.org. Thank you for being with us.
Perfect. Yes. And no problem. Thanks for your time.